Good morning, everyone. Thank you so much for joining the AIM to QAPI program LAN. As a reminder, all of our tools and resources from the PATH Leadership Learning and Action Network are on our website. Everything from the past 2 years, all of our resources are on this website if you would like to go back and access any of them, as well as recordings from all of our past LANs. My name is Francesca Flores. I'll be your facilitator today, along with Margaret White, the Assistant Director of PATH. If you need any help during the conference, please private message me along with Margaret. You can find us in the chat using the participant list. And again, you can chat with us privately or to the whole group individually by choosing everyone. This is the best way to give us any questions you have for us or for our speakers to answer then or at the end of our presentation. Thank you all again for attending our first Learning and Action Network for 2019. This LAN will cover the IHS Strategic AIM QAPI. We have 2 speakers who will talk to us about the QAPI programs. We're going to have Margaret go over AIM to QAPI, and then we're going to have our speaker, Rachel Akins from Navajo area, go over QAPI review worksheet experiences and the next steps they'll be taking. Before we begin, I want to first point out some of the changes we've made to the PATH format based on feedback from your polls and surveys we did from last year. We've provided more time for questions towards the end of the session. We have time for dialogue with the speakers, and there won't be any breakout sessions. We've also had a request to talk more in depth about the IHS strategic aims, what they are, resources that can be accessed, and how other IHS hospitals are meeting the goals for these aims. And now I'll let Margaret speak about our topic for today, AIM number 2, QAPI. Take it away, Margaret.
Thank you, Francesca. I'm going to share my screen here. Just give me a second to do that. I am the Assistant Director for PATH at Health Insight, and I'm speaking to you today as the co-lead for the internal PATH work group for AIM number 2, QAPI. QAPI is Quality Assurance and Performance Improvement. When PATH received the IHS strategic aims, an internal work group was formed to identify tools and resources for assisting hospitals to reach their goals. I was asked to present some background on AIM 2 efforts that PATH partners have made towards assisting IHS hospitals with these goals. One item about wording and language. When speaking about QAPI, we are using the terms as they were listed in the IHS Strategic Aims document. So the A in QAPI is translated as assurance. And those of you who have been around the healthcare quality world will have seen this defined as assessment. We have defaulted to the language used in the IHS document for purposes of talking about AIM 2. Also, when speaking of QAPI, we use the term program instead of plan. The QAPI plan is usually part of the QAPI program. And again, it is language that was used by IHS in the Strategic Aims document. So when you hear program, your facility may use the term plan, and they're the same for our purposes here. First, I wanted to show you the language from the IHS Strategic Aim document. This aim covers 2 fiscal years, 2018 and 2019. In a nutshell, hospitals must annually review their QAPI program. They must have all 5 elements of a comprehensive and integrated program, according to the AIM language from IHS. And for those hospitals who have emergency departments, they must include a monthly chart review of their triage processes as part of their QAPI program. If your hospital completed the QAPI review worksheet and with your PATH partner, you have completed the first bullet on this slide. If you had no significant gaps when going through the worksheet, you have completed the 3rd bullet on this slide. Per feedback from our PATH partners, only 2 hospitals of those who completed the worksheet did not have significant items to address in their QAPI program. There's a little bit of crossover from AIM 2 to AIM 3. AIM 3 is care transitions in the emergency department. The crossover happens with the monthly triage review for the ED. We are in the process of planning future LAN events to address different aspects of AIM 2 and AIM 3, a deeper dive into the details of the aims. Now, this is your opportunity, those of you who are attending today, to chime in. If you have access to chat, please tell us what aspects of either AIM 2 or AIM 3 you would like to see us do a LAN session on. We're in the final planning for the spring LAN sessions, so your input is important. If you're not able to chat, feel free to send me an email at Margaret White for mwhite@healthinsight.org, or you can contact your PATH partner and she'll get the message to me. Next, we're going to look at the 5 elements for the criteria for a comprehensive and integrated QAPI program. Again, this is from the IHS Strategic AIM document, and this details what each element needs to be to fit that into that QAPI program. So they're elements that all IHS hospitals must meet by the end of fiscal year 2019. Each of these elements is addressed in the QAPI program toolkit that was revised by the PATH QAPI work group. I'll be showing that toolkit a little later in this session. And the toolkit can be used by hospitals with their PATH partners to address any gaps in the 5 elements. These elements were also crosswalked to the QAPI tools and resources, so it's clear which section of the toolkit goes with which QAPI element. So for example, if you had a gap in your data collection and analysis, you could go to the toolkit and there's a section that would address that area, that element, that criteria, so you and your hospital staff know what you can do to fill that gap. When PATH received the aims from CMS and IHS, and the internal PATH workgroup attendees identified resources, they made those resources as tools to assist hospitals in achieving the aims. So we did some research through CMS and ARC and IHS and Joint Commission. And what we did is we identified that the CMS conditions of participation and also a document that was designed to help nursing homes with their own QAPI programs ended up being some excellent documents, resources, and tools that could be used for IHS strategic aims. So we took the CMS conditions of participation and made that into that QAPI review worksheet that the hospitals completed. And then we took the QAPI program toolkit for the nursing homes and adapted that also as a toolkit for completing the QAPI program for IHS. These toolkits and resources were reviewed internally by PATH project managers and PATH partners in different states and different regions. After the review, we rolled everything out to the PATH partners in a change packet that was made accessible to them. The PATH AIM 2 workgroup has collected these resources in one place where PATH partners can access them, and they're made available to help their assigned IHS hospitals with gaps found during the completion of the QAPI review worksheet. There's a QAPI program toolkit with the existing CMS documents, and the work group rolled out the worksheet to collect aggregate information about how many hospitals are meeting the aim. PATH partners had conversations with the quality staff at the hospital while doing this data collection, while going through the QAPI review worksheet. And where there are gaps, a PATH partner can use the QAPI program toolkit, which addresses all the 5 elements of the comprehensive and integrated QAPI program. The original toolkit that the PATH internal workgroup worked from is called QAPI at a Glance, and it's on the CMS website. So in the appendix, they go through different steps in order to develop the QAPI program in your facility. And they actually start at the very beginning with things like a mission statement and a purpose statement for your QAPI. And it talks about guiding principles. So if your hospital's already done some of this, you could go on to different sections of the document and use it as you need to. You can start at the beginning, or you can go in wherever it is that you need to go for your particular program. So for example, this section talks about QAPI goals and what they are. They talk about guidelines for governance and leadership. So the governance and leadership is one of the 5 elements of the QAPI program. And not only is there information in this particular document, but we also have other documents, other resources that would help a hospital that might be looking for more information about governance and leadership. And if you bear with me, I will pause there for a second and I will bring up the other document that we want to take a look at. This one is from IHI, and it's specific to, it's a white paper that is specific to board governance. So if your particular hospital, in going through the QAPI review worksheet, decided that board governance was something that you wanted to work with in your QAPI program, maybe in that section of the QAPI review worksheet, you determined that board governance was an area that really needed building up. This is one other resource besides that toolkit that will help do a deep dive about what you can do with your hospital program. It's about 36 pages, so it's not a really long document, but it is longer than just a few pages. And coming from IHI, an excellent organization, one that has best practices that it can communicate to the entire healthcare system. It would be good for both quality improvement professionals. It would be good for anyone that you want to have as part of your governing body. It would be something that your C-suite would read. Anyone that's going to be part of that QAPI program and making that governance a stable and comprehensive part of your QAPI program. These are going to be made available on the Health Insight website after this session, along with the recording, so you'll be able to access it there, or you can talk to your project manager from PATH and they'll have access to these documents also. So of the 17 hospitals that completed the review, we have some of their information. And so the trends are that only 2 of the hospitals met all 5 AIM elements. And that's according to the data collected through the QAPI review worksheet. 2 areas that we're planning to address with a few hospitals are patient safety and board governance. When we looked at the data from these worksheets, they showed us that patient safety was one of the elements of the 5 where it appears hospitals needed the most help. And we determined this because when you go through the QAPI review worksheet, you answer questions about what your QAPI program is or is not doing. And based on that, we determined that the patient safety was the element that probably needed the most assistance at this time. And then the second one was the board governance. So we plan to use the LAN sessions, this one's starting, and then ones in the next few months, where we can provide information and support to hospitals to address the gaps that are identified in the QAPI review worksheet data. So you need to work with your PATH partners to customize the QAPI tools that I've shown and that we'll make available on the Health Insight website, and use those resources to fit the needs of your hospital. And where we need assistance is to have those hospitals that are in progress to work with PATH to finish that QAPI review worksheet so we can collect all the information and aggregate the data. That way we can help hospitals know where they stand compared to other hospitals. So these are our next steps. This LAN presentation with the overview of the QAPI program. We're going to hear from Rachel Akins in just a few minutes about her area and Navajo area office. And then we are going to create more resources and more tools to work towards that comprehensive and integrated QAPI program. We do recommend that hospitals complete this QAPI review assessment annually. It helps the hospital identify gaps in the QAPI program, and then you can be ahead of surveyors instead of trying to scramble and do things right before the surveyors come in. you can be prepared well in advance. Your path partner will be able to work with you on this and help you with any gaps that might be found in that worksheet. And then we will be identifying more resources for those other elements besides the governance body. Now we'll hear from Rachel Akins, who is the Chief Operating Officer at the Navajo Area Office. She has completed the QAPI review worksheet for the hospitals in her area, and she is moving on to the next steps in her QAPI program to address any items that showed up on the worksheet. So they went through each of the facilities and completed that QAPI review worksheet. We'll be talking with Rachel about her QAPI journey that she is on with her hospital. So Rachel, can you go ahead and unmute yourself on your mic?
Yes, I did.
Great, we can hear you perfectly. So what were your initial thoughts when you first saw the IHS aims?
Just one quick thing before we start the questions is I'm actually the Chief Quality Manager.
Oh, thank you.
Just to make that clarified.
Yes.
So, okay, so my initial thoughts were that it was too much to accomplish in a short time, but I don't think that anymore. I see the value in this work and doing what we're doing that affects our patient outcomes. For example, there was an event at one of our hospitals, and because of the QAPI work with this aim, more people are brought together to the table to review events, and we're not doing so much in silos. If this process would have been in place at a time, there may have been a faster response to the event, or there would have been a quicker recognition so that action could have been taken at the hospital.
Great. Did the path partners add value to the process of gathering information from your hospitals?
So having the path partners at the table added value to this work because their presence provided credibility to this activity, and that was invaluable. I don't think the facilities viewed it as another IHS initiative that wouldn't go anywhere, or that this was an area directive where they would not see the results. The activity of going through the QAPI worksheet was a way for the facilities to showcase what they're doing right now and to show people outside of IHS what they're doing well.
And what do you plan to do with the information you've gathered from completing the worksheet for your area office hospitals?
The plan is to meet with each facility and go over the QAPI worksheet results and have an open discussion with them. So with the first facility we visited to complete the worksheet, it was Northern Navajo Medical Center. They actually set the standard for the other facilities because the executive leadership team was actively involved in the QAPI activities and felt that it was everyone's role to be a part of quality. We mimicked that at the other 3 facilities by asking the exec team to be involved in the process. It wasn't a hard sell because all leaders were attentive and engaged. There were great questions and suggestions. This impressed the path partners who were a part of the process, and me as well, since I'm relatively new to my position here. Facilities even asked for a closeout because they wanted to be involved with the results and the next steps. That was impressive. Their willingness to be involved. It was not the quality department driving this, it was the other departments and staff who wanted to be a part of the solutions and actions. I would also say that each facility was doing something that really spotlighted quality in their work. I want to take each one of those and share with the facilities so each facility would not have to create something from scratch.
Exactly. And that's what we're trying to do with creating these toolkits and resources so that each facility that wants to target a particular area of their QAPI program has the path partner, has the resources, and has the tools to do that. So how do you envision path partners assisting you with your efforts?
Well, the collaboration with the path partners is valuable. I envisioning strengthening that relationship. The path partners go on site to visit each hospital. They are assisting and supporting the work of the hospital. This QAPI tool helps identify issues that are systemic and not individual hospital areas that need improvement. We can then work on area-wide solutions and share that with each facility. Path partners support the work of the area office and provide tools and resources so we aren't having to recreate everything at each facility. Path has also given assistance, knowledge, and tools for hospitals going forward, completing the next steps. We can say, this is not just your facility, it is happening area-wide or sometimes even nationwide. It is a lean process that will help reduce variance and will make the process and the answers we find together applicable to all of our hospitals.
Was there anything else that you wanted to add?
So I would like to take the opportunity, and I'm sure I speak on behalf of our path partners too, who are involved in this activity, to thank the hospitals for allowing us to come to their facility and showing openness, honesty, and being forthright about answering the questions on the QAPI tool. I am excited to be a part of that dynamic. I could see the passion in the room. When we visited the facilities and asked them the questions, they wanted the best for the patients and their patients. And they showed us the work they do is because of the patient. And one other thing that seemed to be consistent, a consistent feeling at every hospital was that IHS wasn't any different from any health system that provides health care in America. We have challenges. We all have our bubbles we have to work in sometimes, but it doesn't make us different.
Exactly. Can you tell us a little bit about how you rolled out that QAPI review worksheet where you went to each of the hospitals? So you said you started with one facility first. Which one was that?
Northern Navajo Medical Center.
And when you were there, they set the stage. They had the executive team there in the room, correct?
Yes.
And they were engaged and participating. And there was a specific request that they had at the end when everything was done with the worksheet, that they did a closeout.
Yep, they wanted to know what we found. They said, we want to come back together with you and the path partners and tell us what your results were. And yeah, and it was really interesting. At every facility, I could say that the quality team wasn't the ones talking the most. It was leadership and the CNEs, the CMOs were very engaged. The CEO was, again, asking the questions like, okay, we're doing this, but what are you going to do with it? Because they really want to see action happening.
And then you and I had talked last week about some of this data collection. So you've gone through the QAPI review worksheet. You know what it is individually for each facility because you wrote the answers on the worksheet. But can you talk a little bit about what kind of data you might need area-wide when you talk about systemic changes? What kinds of information might you need to see there?
So what we're envisioning is taking the information and the data and putting it in a comparison so that we can see how we're doing as an area, but then also how each facility is doing individually. And that would, who's doing well, let's share those things. What are you doing? What makes a difference? How can we incorporate another hospital that maybe needs some assistance in that area? And then also creates a little bit of competition. It was interesting that every hospital group said who's the best. They wanted to know who the best was. And of course each one was, because they all had something that they're doing that's unique to them, that I could see taking that and applying it to other hospitals.
That's great. That's that lean principle of taking a best practice from one facility and spreading it to others. And Path is planning on working on taking that data and providing that information back to you and to other area offices that completed the QAPI review worksheet, and to give you that vision, that maybe a little bit of a bird's eye view of seeing, where your different facilities within your area are doing well and where others need help on a systemic basis.
Right.
So we're going to open up this time for chat, and we're going to allow people to ask questions of Rachel or of myself. And so if you do have access to chat, please go ahead and put your questions in there for everyone. Otherwise, if you're just on the phone, you can toggle with *6, and you can unmute yourself to ask a question also. We'll give you some time to do that. So while we're waiting for people to put in questions at chat, Rachel, I know one of the things that you're interested in for your areas is the governing body and the governance element of the QAPI program. You had also looked at the IHI document that we had on that. And what do you think might be your next steps in that area?
So the governance document referenced a questionnaire that you can do with your governing board, and it scores. They can score like how well they think they're doing this, and I can't remember off the top of my head what the questions are, but each governing board would answer those questions, and then you get a score, and overall score, and then it tells you whether the governing board is like how they rate, as well as being very I forget like the terminology, but it's not 1 through 5, like initial QAPI is being presented in governing board, or advanced, that actions really are being taken and decisions are being made based on governing board involvement. So I would actually like to have each of our facilities use that at the next governing board meeting. So we're in our cycle right now. I believe they're having governing board this month. So it would be like our next quarter. And just to start there.
And so you would have each of the members of the governing board for each of the facilities fill out this particular questionnaire or assessment that's within that IHI document?
Yes. Yes.
So once you got the information back on that, would you still try to do like a lean type of vision where you'd look over these answers area-wide, or would you drill down to each facility, do you think?
Our CMO actually also wants to bring in governing board training for our facilities. So it's at a little higher level first, and then drill down.
Okay. And we do have a couple questions in chat. One of them is from Denise. Rachel, what are your next steps going forward? So we talked a little bit about the assessment for the governance. Are there some other next steps that you're planning?
Yes. I'm looking at, and I did send this out to the quality manager area, in all the areas, as well as headquarters, is to develop a reporting tool for our facilities that's consistent, so we can compare like to like. And I use the word dashboard, but I'm not a big fan of dashboards. But I'm thinking more of like a profile. Like, here's the things you would report on every quarter to governing board, but it's also reported to the hospital leadership on a monthly basis. And not that you're taking action on every one of the items on the profile, but that it helps you identify whether maybe there's something you want to look at additionally.
Great, great. And so when you're going to be looking at that information, so you're saying that you're going to be doing it from a high level and you're going to be drilling down, but that you're not a fan of dashboards. So what might this look like then? Well, how might you communicate this?
So what it looks like is the information needs to be gathered, and you need to be able to put it into charts and graphs, and that's what I would see reported to governance and higher up is a run chart, a control chart once you get enough data points. But the dashboard or the profile has to be in the background because you can't get the charts without that information. So it would have to be managed monthly. One of the other things too is we actually took some of the aims and put that into that profile. So it will always be reported. This is what the medical staff, or this is the nursing, it'll always be reported through governance.
Okay. There's another question in chat. How can the CEO move this work forward? So when you're talking about, working with the governance boards and reporting to them and collecting this information and moving forward with your program, how are you planning on bringing the CEOs in?
Well, leadership and CEOs driving the ship is setting the stage. They set the expectation. If data is presented, so again, and me not being a fan of dashboards, the reason I say that is what I've experienced is dashboards are submitted to governance or to leadership, and then you have to interpret it, and it's large and it's, all this stuff, and it's just too much. So that is where I would see leadership saying, the CEO saying, this isn't the format I would like to have the information presented. I would like it in a way that we can use to make a decision from that tells us quickly. And that's why run charts are so great, because you can just look at them and tell, are you getting better? Are you going worse? Or, that kind of thing. So that's where I see leadership and CEOs' involvement is saying, this is what we want to do.
I like that. It's showing your progress. Those run charts are going to be showing your progress on your QAPI journey. The other question that came up is, what would be a recommendation to get other area offices involved in this initiative? The QAPI program and moving forward to next steps.
Well, I think there is a lot of involvement already, just from the discussions that I've seen, and also on the headquarters quality calls and the combined council meetings. This is at the forefront. I think if we had the tools, like, that's kind of what I envision as well, is when we ask people to do something, not just say, I want you to improve quality, but then say, here's a roadmap, here's where some gas stations are. If you're going from Chicago to Los Angeles, how are you going to get there? Fly, take a train? Just provide a little more guidance than just overarching. And that's where I see our role as an area office, is to provide the tools and let the facility choose what works for them, because there is little variance, but reported can still be consistently the same, if that makes sense.
Yes, it does. Yes, having the facilities be able to be flexible and how they address the different things in their QAPI program that they want to address, and having multiple tools and resources for them to utilize. It's a little bit easier. It's sometimes, even from a lean perspective, not one size fits all. There needs to be some adaptability to a certain extent. One of the other questions came from Carolyn. How can IHS transfer skills from the success with GIPRA to the AIMS, is her question. Do you have any thoughts on that?
Well, what's interesting is, and people that know me have heard me say this several times, but when we do quality of care, GIPRA takes care of itself, because we're taking care of what needs to be done for each one of our patients. And the numbers are going to show. We're going to show that improvement. So that's kind of how I see this same approach. Is we get so caught up on taking a big number of patients, or we have to do 100, or we got to do this. But what about the patient sitting in front of us? What about that one patient, one at a time, and building from there? Because that's where our habits are built. And I like that saying by Aristotle. It's like, we're not, no one's perfect or excellent, but if you always approach something with excellence, you then become excellent, right?
Exactly. And I think that idea of addressing, of treating the patient in front of you and doing that excellent work with that particular patient, you repeat that with every patient, with every family member, with every person in your community, and you do meet the aims and the goals and the measures that you want to meet. So we talked a little bit about a dashboard. There was a question also from Carolyn. Are there plans to develop a dashboard that can be viewed by all participants? And I think, if I'm interpreting this correctly, this might be with information that came in about this particular aim through the QAPI review worksheet. And so we talked a little bit about that. Of the 17 hospitals that completed the QAPI review worksheet, so we have that information. And what PATH is planning on doing is to be able to provide to those hospitals that completed the worksheet a facility level report, so each facility can see what's going on there individually, an area office level one. And then I showed you today what the overall of all the 24 hospitals in an aggregate is. And so we're going to try to start with some of those reporting, that kind of, it might be a dashboard, but it might also be looking like some type of run chart, especially if this is done annually. We can build on the data collection that we already have. And so I think that that would be the plans for that. And so we would provide it to people like you, Rachel, and then you could get with your quality teams at your area office level and at your facility level, and you can create action plans and make performance improvement projects around the items that you feel are necessary for each of those. Does that sound like good next steps too for you?
It does. And that's actually what we want to do, but also not add more to what the facilities are already doing. So if again, going back to sharing practices, if someone's already doing something well and we're not just adding another thing on top of that, let's let them, not let them, but we want to encourage them to keep doing that. Don't give up this to do that, something else,
But there could be alignment if someone's already working on something on patient safety, and then they get some information from this QAPI review worksheet data that says, yeah, you really do need to be working on patient safety. That kind of helps with that. And it might be another way to measure what progress they've made on patient safety. Rachel, I just want to take a moment right now and thank you very much for taking the time to be with us today. You and I have been working on this the last few weeks, and I really appreciate your honesty and your details And I think it's helpful for other IHS staff to hear from one of their own about this. And people in chat are saying, great job, Rachel. Thank you for sharing. We really appreciate it. So I'm going to go forward here. And if there's any other questions, this was another opportunity for people to ask questions. And again, if you would like to send any questions to myself, it's mwhite@healthinsight.org, or Francesca Flores, it's Flores, Flores, @healthinsight.org. You can still do that. Or if other questions come up as you talk to your project manager, those can definitely come back to us. We're looking that as we go into these aims deeper, we hear from the hospitals and hear what you need, like reports and data collection and resources, and how to take the next steps on the QAPI journey. And then our last slide here is that we want to remind you that the LANs now are the first Wednesday of the month, and our next LAN is Wednesday, March 6th. And we have our times there, Eastern, Central, Mountain, and Pacific, and it's for 1 hour. And we'll be dropping the LAN feedback survey in chat. We do want to hear from you. And we are on our own quality improvement journey, so we appreciate your feedback. We do try to incorporate the feedback that we see into future LANs and improving the process for everyone as much as possible. And so we'll leave that poll up there for a few minutes. And again, thank you, Rachel. We appreciate your time. And thank you, everyone in the background that's been helping on this and the people that put in the questions. Appreciate your time. Have a good day.